So my name's David Pannell, and I'm the Chief Exec of the Suffolk GP Federation. I helped found the Federation in 2007. It was a group of practices in Suffolk which became nearly all of the practices, set up the organisation, and the idea of the organisation was to support general practice within Suffolk, but also to provide services to patients in Suffolk and the surrounding areas. We have grown really from being very small to being quite a significant organisation, and the things that we were founded on are still things which are really evident today within the organisation. The types of things are teamwork, working together to come up with innovative solutions to problems facing the health service, working collaboratively, particularly with general practice, with our hospitals, with our community services, with colleagues in social services, and to be passionate about delivering really high quality services. And all of those things that we were founded on really are still very evident today in what we do. In terms of supporting our staff, we know that the pressures on them delivering services in the current health and social care system are really quite significant, and we want to do more to support their well-being. So we made a very small start with purchasing something called Perk Box, which is a package of benefits, including things like counselling support for people that are facing distress or have got debt problems and the like. And so we want to really focus on improving the well-being and supporting staff.
My name is Dr. Ruth Bushaway. I am the Medical Director of the Suffolk GP Federation.
Can you talk us through your main responsibilities, please?
As the Medical Director of the Suffolk GP Federation, I am part of the senior leadership team. I oversee the other medical directors, and we have 2 medical directors in urgent care, one for primary care, and we have a medical director for mental health as well. So they are responsible for those areas, but of course I maintain an oversight, so I would attend all the monthly meetings of the different services. I think the breadth of what we do makes my job really enjoyable. It's a different thing every day, and yet it's all in an interesting and really well supported structure. And I have to say the staff are fantastic. I've really enjoyed getting to know everybody and working out those relationships and trying to assist in making things run well.
Can you give us some examples of why a staff member might need to speak with you?
There's a whole range of reasons why staff members might want to speak to me. I think one of the very fortunate things of being full-time in this job and not trying to fit in too much is that I am able to be visible and to be present. So it allows me to be seen to be available, so that questions are raised early. If somebody has a datix they wish to discuss, an incident that might have happened, or a question about a protocol or a procedure or something along those lines, that actually they feel that they can ask. I've often say in my role previously as a GP trainer, there are no stupid questions, and I think that ability to just be seen to be approachable, I think is really important.
I'm Martin Edwards, and I'm the Chief Nurse for Suffolk GP Federation.
What are your main responsibilities?
Well, I have a number of responsibilities. So they fall into 2 camps really. I have a professional role, which is around looking after nursing and promoting nursing, and promoting all the roles that sit within that non-medical area. So developing a whole range of different roles for paramedics, for physios, looking at extending those roles, how we move into prescribing and enhanced clinical practice. So from a professional point of view, I want to see us developing a broad range of professionals who can meet the needs of our patients. From a governance point of view, because I lead the governance team, the governance team is around making sure that we're compliant with legislation and with guidance, and ensuring that we are delivering high quality services.
How does an incident or complaint get recorded?
So we really want to encourage people to record incidents. So you can't really go wrong. If you can reach a Fed computer, you can log on to Datex. You don't need to have a password or a username. You can get on and log an incident.
My name is Julie Smith and I'm the Operations Director.
As Operations Director of the Fed, what sort of challenges do you face day to day?
So every day is different and that's what I like about it, but mostly my days are made up of lots of meetings, juggling meetings and dealing with day-to-day operational issues. It's quite difficult to plan my day, they often don't pan out as I've anticipated, so quite often, hence the reason quite often I'm running late for things. So I guess my biggest challenge is probably timekeeping.
How is the Fed different to other NHS providers in your opinion?
So when I joined the Fed in 2012, it was a really small organisation of about 12 people and it's now over 600 people. But what we've tried to do through those years is keep the small company feel to the organisation. That's obviously got harder as we've grown over the years. So what it's about for me is, and how we're different, is that we work very much together as a team. We can be really agile and responsive and achieve lots of really good things. And one of the key things about the Fed that's different, I think, is that we actually deliver. We have a track record of really actually delivering things.
How does the Fed manage such a wide variety of services?
So the Fed delivers a real diverse range of services, and that is actually often overlooked and not appreciated. The key thing that we do as a Fed is that our services are clinically led, so we put people at the helm of the service who actually have the expertise in that particular service. And then we support that and provide resources to enable them to make things happen that they want to happen. No two services are the same, but actually there's a lot of common ground.
In what ways is the Fed innovative in how it operates?
The first thing is that we always start with clinical model. So we don't look at governance, contracting, and least of all the money around things or the finances around things. So we start with the clinical model, we design what we think is needed, and then we wrap everything else around that. The organisation inspires people to develop their services just simply by letting them do it. If you put up obstacles and barriers, people stop thinking creatively and just carry on doing the same.
Hi, my name is Matthew Casey. I'm the Deputy Operations Director for the GP Fed.
Matt, you've recently joined the Fed as Deputy Operations Director. What are your first impressions of the Fed?
Very, very good ones. A couple of things I first noticed about the Fed were its broad range of responsibilities. It has a huge variety of tasks that it's responsible for, from stoma to mental health to urgent care. It's quite a responsibility for the Fed to carry, and I was really impressed by that. The second thing I noticed was the innovation that it's so comfortable with. It's always looking for new ways of approaching problems. It's very open-minded and forward-looking, and the thing that impressed me the most was it's absolutely unflinching in using technology for best results. The last thing was the staff. Some fantastic staff working in the Fed, bright, positive, very capable, and with patient outcomes at the very forefront of their thoughts.
Where do you think your focus will be over the next 12 to 24 months?
It's a really good question. At this stage, my efforts are entirely aimed at getting a full understanding of the Fed and its operations. It is a huge organisation with a diverse range of responsibilities, and getting to grips with that and understanding the detail of that is my utmost priority. Just below that in priority, I'm also very keen to understand the shifting characteristics of the health sector that the Fed operates in, and meeting the specific needs of the people of Suffolk.
Dr. Ehsan Ahmadi, GP at Ipswich, and also the Joint Medical Director for Suffolk Federation.
Debs Banerjee, Medical Director, Suffolk GP Federation, Medical Advisor, NHS England.
As urgent care medical directors, what are your main responsibilities?
So our aim as co-directors are to make the services seamless, easy to approach, and to see the right person for the right problem at the right time.
If I add on to that, basically, the top priority then remain to provide a safe and efficient service to our patients. To achieve that, we have got quite a robust recruitment service. We interview clinicians before we're getting them on board. We then monitor their performances, looking their consultations, looking at their records regularly. We deal with the complaints together, complaints and incidents that they get involved, and then we learn from the lessons, and we share the lessons with other clinicians as well. Also, we support GPs with providing regular training sessions, quarterly training sessions for GPs. In out of hours, we also train in urgent care. We train GP registrars or GP trainees. They are going to be, our future GPs, and it's very important that we invest as much as we can in training them.
I'm Tom Curtis, and I'm Primary Care Medical Director for the Suffolk Federation.
Tom, what does a typical day look like for you?
I don't have much of a typical day, which is, I think, the nice thing about my job, really. So today I was doing the standard GP clinic. Tomorrow again I'm the duty doctor at the Clements surgery. So I spend about half my time being a GP and a doctor, and then the other half doing the medical director related aspects of the job, which are quite diverse. So meetings, reviewing the performance of the practices, dealing with incidents, complaints, compliments. So it's quite a diverse role.
I'm Sheila Smythe, and I'm the Director of Community Services for Suffolk GP Federation.
Sheila, tell us about your key responsibilities as Director of Community Services.
My key responsibilities are overseeing 7 community services within the Federation, and they are diabetes, ultrasound, podiatry, bladder and bowel, stoma, fracture liaison services. I work with them to ensure that they provide an excellent care of services to the patients. I work towards any NICE compliant guidelines, standards, and develop their services to make sure they're efficient.
My name's David Hockley, and I'm a Director of Urgent Care for the Fed.
Can you tell us some more about the Fed's urgent care services and your role specifically?
So my role specifically within urgent care is that I'm the director. So I have overall responsibility for making sure that we deliver the services in accordance with our contracts and in a way that means that we're serving the patients in the best way that we possibly can. So to that end, I work closely obviously with my management team, also with the CCGs, with West Suffolk Hospital, Ipswich Hospital, obviously Felixstowe as well. So bringing it together to make sure that we're delivering a really good, safe, reliable service.
I'm Wendy, I'm the Nurse Clinical Lead for the ADVAS part of the Integrated Urgent Care Service.
And my name's Katrina, and I'm the Nurse Clinical Lead for GB Plus and the streaming side of the service.
As Nurse Clinical Leads, describe for us what your main priorities are on a day-to-day basis.
So I guess on a day-to-day basis, one of my main priorities is to identify any issues that have arisen on the previous day within the service, review the shift report, see if there's any lessons to be learned, any actions that need to be taken from that to make sure we're running a safe and efficient service. In addition, I am involved in auditing, which I do some kind of audit most days, 1% clinical audits, prescribing audits, and just generally responding to the mountain of emails that lands every day.
Similarly to Wendy, each day follow up the debriefs on the shifts from the day before, so from all the centres across Suffolk. May raise problems with clinicians or equipment, or service users may have had issues. If there's any complaints or incidents that have been raised, then it's to address them and deal with them. Trying to offer support to the operational team as well if they have any clinical questions, often related to equipment, stock, general running, clinical side of the service. Sometimes it's rota issues as well. Audits is a big part of our job, as Wendy's mentioned. We also have to try and make time. We generally interview on a rolling process, so we have interviews most weeks with new staff coming on board as well.
I'm Sarah Moody, the HR manager for the Fed.
As HR manager, describe for us a typical day at work for you.
In terms of kind of HR roles, we do inductions once every fortnight. We might be helping with people's holiday queries, their contract queries that they might have, but it's also about supporting the service managers and being at their beck and call as any problems or issues arise. We're also just looking at our benefits packages that we can have at the moment and any potential holiday changes, anything like that we might be able to bring in is what we're kind of working on at the moment.
What do you think makes the Fed a good place to work?
So it's a really flexible organisation. One of the best things I think about working for the Fed is it feels really small. We also have some really great employee benefits that we have at the moment. So we've just rolled out Perkbox, which is the employee benefits platform, and it allows people to try and make their salary stretch a little bit further each month. So we have things like half-price cinema tickets, a free coffee or hot chocolate at Nero once a month. We also are now just rolling out a bit more of a focus on well-being.
Can you give us some examples of why a member of staff might need to speak to you or somebody on your team?
So I think the main thing is there's no silly question. People come and speak to the team and to myself about pretty much anything. You can imagine the work-life balance and you don't always leave home at the door when you come to work. So we like to support with not just work-related things, but as far as we can. Or it might just be, I don't think my MorePay is working. Can you reset our passwords? We get that quite a lot. We also help with mandatory training, so scheduling dates. It just really depends whatever that person is struggling with or wants a bit more support with. There is nothing that's out of our realms.
I'm Jenny and I'm the Communications Manager for the Fed.
Jenny, tell us about your main responsibilities.
So my main responsibilities are managing the Fed's websites. I manage the social media accounts, so that's Twitter and Facebook. I am also responsible for writing press releases and dealing with any media inquiries that we have. I do a lot of design work, so I design the newsletters and any patient-facing leaflets, and I would support various projects through the organisation with communications plans. So, for example, if we were doing a service change and we needed to communicate that to patients, I would develop a communications plan. It's a very varied role. It's a role that means I can get involved across the entire organisation, and there's definitely no 2 days which are the same.
Can you provide some examples of why a staff member might need to speak with you or Emma?
There's various reasons why somebody might need to get in contact with us. It might be that they would like to communicate a good news story across the organisation or to other stakeholders, patients. They might wish to create a patient newsletter. We can support with that. It may be that the press has got in touch with them and we would draft the response for them. It could be they've spotted something in their patient leaflet that they'd like to change, so we would do that for them.
My name is Amy Garnham and I've been with the Fed for almost 2 years now, and I've just moved into the role of Finance Manager.
My name's Karen McCormick. I joined the Fed in March this year and I'm the payroll officer.
Amy, as Finance Manager, what are your main responsibilities?
So my main responsibilities are to oversee the finance and payroll department.
Karen, as Payroll Officer, describe what you do on a day-to-day basis, please.
And mine is just processing the payroll and keeping everybody paid.
Can you give us some examples of why a member of staff may need to contact you?
So within the finance department as a whole, we tend to mainly have people like outside of the organisation contact us. So if they require payment for a product or a service, we do often have sort of some members of staff, mainly service managers, contact the accounts department mainly because they're in charge of the budgets for their particular service. So that will be if they have a query with regards to an invoice. If it's an unexpected invoice that's come in. So we also have sort of a lot of self-employed GPs within the urgent care service, so they tend to contact us with regards to payment sort of mainly.
What are the organisation's plans for the next 12 months?
In terms of services, the next 12 months is mainly a period of consolidation. We've taken on a number of new things over the last 12 months, including the out-of-hours service in Suffolk. We've taken on another small practice up in Haverhill, and we need to bed those in and consolidate those.